Doctor, I think I need a blood test. This is a very common statement and then request from patients sometimes when they come consulting with doctors or with their physician. Now, what is a blood test? What are the facts about blood tests? Why are blood tests important? These are some of the information I'll be giving to you in this video. You're welcome once again to my YouTube channel. This is Health and Lifestyle with Doctor Soyemi. Health and Lifestyle with Doctor Soyemi. Remember to subscribe to this channel if you are yet to subscribe so that you can get regular updates on health matters. So what is a blood test? Simply, a blood test is also known as a blood work. This is a test that is carried out on the blood for examining the cells, different components of the blood cells, and chemicals, proteins, enzymes in the blood. Usually, blood sample is taken from the arm of the patient or individual using a needle, and of course, sometimes people feel pain, some people feel it less, some feel it more. Okay, and it's taken into the syringe and put into the sample bottle for the test. So apart from the arm, apart from blood sample being taken from the arm, blood sample can also be taken from the heel or finger. If it's a child or a baby, neonate, blood is actually taken from their heel after cleaning appropriately with the methylated spirit or agent that is to disinfect the area. The needle is put gently into that area. Also may be used for blood sugar tests, for example, using a glucometer. Also for adults, tests like malaria parasite, rapid diagnostic test, also done for HIV screening, syphilis. Some other tests may require just a finger prick, especially in emergency situations also. So blood sample can be taken from anywhere for blood test. I want to talk about 6 facts about blood test. Stay tuned. The components of blood vary, and these are different components that require different examinations, investigations to be able to make a diagnosis or confirm a diagnosis when a patient is being examined for certain symptoms and signs that have been discovered. In this particular video, I want to talk to you about 6 facts about blood tests. 6 facts about blood tests. So here are the 6 facts I want to mention in this particular video. 6 facts about blood tests. Number 1 fact is this: blood tests are quite useful in making a diagnosis. Actually, very useful in confirming a diagnosis, because most of the time, as a doctor checks on you after you give your complaints, the doctor is already thinking of a particular condition or disease or disorder for which a patient may be presenting. And just for confirmatory purposes, some blood tests may be required. For example, malaria parasite check using a microscopy, or a rapid diagnostic test using kit. In that case, where it's just a finger prick that is done. So this is useful in making a diagnosis, in confirming a diagnosis. So somebody can present with symptoms of malaria, and doctor examines and then confirms with a blood test. So blood tests are useful for making diagnosis or confirming a diagnosis. Fact 2 on fact about blood tests is that blood tests are useful before initiating a treatment. For example, patients that are to be started on anticoags, actually we call them TB drugs, they are required to do liver function test to check for the enzyme levels of the liver before commencing the medications, because some of the medications would affect the liver, and also kidney function test is done. So the fact number 2 is that blood tests are useful before initiating treatment. The third fact on blood test is that blood tests are useful in determining if complications have taken place. They are useful in determining if complications have taken place for certain conditions that have been diagnosed. What happens is this: the condition can worsen and affect some organs, some other parts of the body. So it's important to check. For example, a patient that has hepatitis B or hepatitis B positive individual, sometimes over time, some people could have their kidney damage worsening, and one of the things that is done is to have a regular liver function test done. So to check if conditions are setting, patients may present with yellowness of the eyes, and then doctor examines, feels the liver may be enlarged. So a complication in that situation could be a liver cancer. Such patients can have their liver enzymes checked using a blood test, and the liver enzymes will be markedly elevated. So blood tests are useful in checking for complications. So the fourth point is that they are useful. That's the fourth fact, that blood tests are useful in making a prognosis. Prognosis in the sense that to determine whether the rate at which an individual is going to come down or die from a particular condition